Question number 1 was enumerate the various PFTs. It was of 4 marks. Okay. You have to just enumerate. The question says just to enumerate and it's of 4 marks. So answer will be, first you say about bedside PFTs. Bedside PFTs include the following. Number 1, Sabra says breath holding test. I'll just explain it, all these things also. Okay. So here what we do, but we will not write. You have to just write the name. So first I'll just mention all the name and then I'll explain it. Then we have single. That's why I took the question instead of giving the PDF. Single breath count. Third will be Snyder's match blowing test. Then fourth is cough test, or we call it deep breath test. Followed by cough. Deep breath followed by cough. Fifth is forced expiration, FET. That is forced expiration test. Sixth is right peak flow meter. Okay. Seventh is De Bono whistle blowing test. It is right respirometer. Ninth is micro spirometers. 10th is bedside pulse oximetry, because that also tells us something about your respiratory system, your lung functions. So these are your bedside PFTs. Now I'll just describe each one so that you know, so that it's easier for you to remember. Now the first one, Sabra says breath holding test. So in this test, what we ask the patient to take a full breath, but not too deep breath. We ask them to take a breath, hold it as long as possible. If it is for more than 25 seconds, then we say that it is normal cardiopulmonary reserve. Okay. If it is between 15 to 25 seconds, then it is limited. And if it is less than 15 seconds, then it is very poor. Okay. Then similarly, and what it corresponds also very good. You know, if it is between 25 to 30 seconds, this Sabra says breath holding test, if the breath holding time is between 25 to 30 seconds, it almost corresponds to 3500 ml of vital capacity. Similarly, for 20 to 25, it is corresponding to 3000 ml. 15 to 20, it is corresponding to 2.5 liters. 10 to 15 seconds, it corresponds to 2 liters. And 5 to 10 seconds, it just corresponds to 1.5 liters. So it indirectly tells us about the vital capacity. Similarly, in single breath count, what patient is asked to take a deep breath and then we ask him to count till the next breath. And normal person or with a normal lung function will be able to count up to 30 to 40. That indicates again his vital capacity. In Snyder's match blowing test, this I'm just explaining for the answer purpose, you need not write it. For Snyder's match blowing test, what is happening? This test actually, it will measure this one, Snyder's match blowing. These two are measuring what? Vital capacity. Okay, vital capacity. And this is measuring what? Maximum breathing capacity, MBC. Maximum breathing capacity. What is done? Patient is asked to blow a matchstick and from a distance of 6 inches or 15 centimeter. 15 centimeters से हम उसको बोलते हैं अब ये मैचस्टिक लगा दिया या कैंडल लगा दिया, उसको ब्लो करो. If he is able to blow or not. Distance is 15 centimeter. So, and what is the prerequisite? Patient has to do it with a wide mouth open. Chin has to be supported and there is no purse slipping. Why no purse slipping? Because if purse slip करोगे तो area of cross section घटेगा, velocity of the blow, the air will increase and that will blow. So it has to be via wide mouth open. No head movement, no air should be in the room, and mouth and matchstick should be at the same level. So considering all these things, and this is measuring your maximum breathing capacity. If the patient cannot blow out, if the patient is unable to blow out, it means the MBC is less than 60 liter per minute. And that corresponds roughly that FEV1 is about 1.6 liters. Now, if the patient is able to blow out, that means MBC is more than 60 liters per minute, and FEV1 is definitely fairly good. It is more than 1.6 liters. Now, modified matchsticks, there were some people who have modified this matchstick test. Instead of the distance 15 centimeter or 6 inches, they have made it at 9 inches and 3 inches. So if 9 inches से भी blow कर पा रहा है, that means उसकी MBC और better है. That is about 150 liter per minute. And if the patient is not able to blow at 6 inches but is able to blow at say 3 inches, तो उसकी MBC कितनी होगी? लगभग 40 liter per minute, and corresponding FEV1 is there. Similarly, cough test, or D, as the name says, deep breath followed by cough. So in this, actually, it is to see the ability of the cough, strength of the muscles, and if the patient is unable to cough, inadequate cough है, that means कि FVC बहुत reduced है, less than 20 ml per kg you can say, or PEFR is less than 200 liter per minute. Then we have this test is important, post expiratory time, FET. Patient is asked to take a deep breath, exhale maximally and forcefully post expiration, and doctor keeps the stat over the trachea and then listens. Normally the time of expiration, this is this what we are getting it from the PFT in automated way. This is was done rather manually. Normally it is 3 to 5 seconds, but if this expiration prolonged है, more than 6 seconds है, तो obstruction, less than 3 seconds है, तो restriction. So this was post expiratory time. Right peak flow meter, it measures the PEFR. So this, as the name suggests, it measures PEFR. Normally कितना होता है? Male and female में it varies. Male में 450 to 700 liter per minute, and female में it is 350 to 500 liter per minute. Then we have again de Bono whistle blowing test. Here patient is asked to blow the whistle. This is also measuring PEFR. This also measures PEFR. Then right respirometer. This is measuring the tidal volume and minute ventilation. Okay, and it is usually used for weaning from weaning from ventilators. Then we have microspirometers, which are measuring vital capacity, and bedside pulse oximetry. All of you are well versed. So these are the bedside PFTs. Then we come to, then you write in your answer, you continue with after that. The other major PFTs include spirometry, 25. Rarely obstruction. Okay. So spirometry is used for measuring FEV1, FVC, and the ratio, obviously. And flow volume loop that helps identify upper airway obstruction. Then we have broncho dilator response for reversibility and all. Then lung volumes. That gives us TLC. Then MI, maximum inspiratory pressure, and MEP, maximum expiratory pressure. This actually detects respiratory muscle strength. Then DLCO, and then sub-maximal exercise testing. Are there some? Sub-maximal means what? Why it is called sub-maximal? Like 6-minute walk test. Is when we ask the patient to run at his own pace, he has to do. And obviously, pulse oxygen saturation that we talked in the website. So these are the other pieces. This was only for 4 marks. You have to just enumerate. Then the next part of the question is about DLCO, about the indications, contraindications, and methods of DLCO.